When people enter the hospital, staying healthy during the visit is the last thing on their minds. People go to the hospital to get healthy. Why should they worry about becoming ill? The fact is, when people enter the hospital, they are putting themselves at risk by entering a breeding ground for infections. Hospital-acquired infections are becoming more and more common in American society.
Well, one of the problems, of course, is that as we have more crowded facilities and have more crowded populations in using these facilities, we have the introduction of various organisms into the hospital, various viruses, various bacteria, and so forth.
So you make it sound as if it's a seething cauldron of disease.
Well, you might consider it a seething cauldron of potential disease.
Hospital-acquired infections are estimated to occur in 5% of all acute care hospitalizations. Based on the patients admitted to acute care hospitals annually, the incidence of hospital-acquired infections is more than 2 million cases per year. Hospital-acquired infections result in an additional 26,250 deaths per year in the United States alone, but some studies have shown numbers in some years as high as 70,000. They also create an added expenditure in excess of $4.5 billion. Hospital-acquired pneumonia is the second most common nosocomial infection in the United States, with 300,000 cases annually. It carries an associated mortality rate of 30 to 70%. Risk factors for developing hospital-acquired pneumonia include age over 70 years, serious comorbidities, malnutrition, impaired consciousness, prolonged hospitalization, and chronic obstructive pulmonary diseases. Mechanically ventilated patients are 6 to 21 times more likely to develop hospital-acquired pneumonia than non-ventilated patients. Mechanical ventilation is associated with high rates of hospital-acquired pneumonia because the endotracheal tube bypasses upper respiratory tract defenses, allows for pooling of the throat secretions, and prevents an effective cough. Mechanically ventilated patients are 2 to 10 times more likely to die from hospital-acquired pneumonia than those who develop a condition without mechanical ventilation. Staph infection is a major infection that occurs when the staph bacteria enters an open wound, resulting in a dangerous abscess. It can also result in impetigo. Unfortunately, it's becoming more and more popular in hospitals. If untreated, it can result in toxic shock syndrome and ultimately death.
Here's the irony. In almost every part of the United States, restaurants are inspected for cleanliness, but not hospitals, not even operating rooms. You can go home and make your own dinner. Until 1970, hospitals regularly tested the surfaces for bacterial content. In 1970, the Centers for Disease Control and Prevention and the American Hospital Association literally announced that hospitals should no longer be expending resources testing for bacterial contamination. But the fact is, since that time, MRSA, for example, one of the deadly superbugs, has increased 32-fold.
Hand washing is an overlooked but very important act. It is extremely easy to do, but due to time constraints, physicians may neglect to wash their hands before and after every patient contact. Should a patient notice a physician did not wash his hands upon entering the room, he should request the physician do so. Even using gloves does not guarantee sanitary conditions. If the gloves were put on using dirty hands, they are dirty too. Taking this simple step of hand washing can prevent the spread of infectious disease. Believe it or not, many people do not know how to wash their hands properly. This poster, often found near sinks in hospitals and doctors' offices, shows the proper way to wash hands. Treatment for hospital-acquired infections is vital. Many of these infections, if recognized and properly identified in time, can be treated relatively easily. For hospital-acquired pneumonias, ventilator tubes should be changed, preferably with orotracheal tubes. The patient should also receive broad-spectrum antibiotics as well as antivirals for influenza. Individuals with bloodstream infections should have any IV lines removed with suspicions of causing sepsis and should receive medications. Patients with staph or MRSA need to receive antibiotics quickly. Surgical site infections require medication and may require further surgical intervention to remove infected tissues. The best method to prevent hospital-acquired infections is the proper use of universal precautions. This includes wearing gloves when contact with bodily fluids is possible. Masks should be worn to prevent spread of disease as well. Everything in a hospital or physician's office needs to be properly cleaned and maintained to prevent infection.